Ladies and gentlemen, welcome back to MedSynapse, the podcast where we connect you with leading experts in the medical world. Today we have an esteemed guest joining us, Sami Mansfield from the USA, the visionary founder of Cancer Wellness for Life, revolutionizing exercise oncology and lifestyle medicine for cancer patients worldwide. Starting her career in 2003, Sami emerged as one of the world's first experts in exercise oncology and lifestyle medicine. Her contributions have left a lasting impact on state cancer control plans, focusing on lifestyle, exercise, and obesity management strategies for cancer prevention and survivorship. Notably, her expertise played a pivotal role in authoring the American Society of Clinical Oncology Guidelines on exercise, nutrition, and weight management during active treatment, and the exercise recommendation for people with bone metastases, offering valuable insights to healthcare providers and exercise professionals. Also, as an accomplished public speaker, Sami has captivated audiences with hundreds of presentations, podcasts, and virtual events. In 2016, Sami introduced BUILD, the first functional fitness exercise program for cancer survivors based in Kansas City, later expanding to We Build for Life Wellness and Fitness Center in 2019. In today's discussion, we have a very interesting topic: exercise in the cancer setting. Welcome, Sami.
Welcome, Dr. Nigar, and the entire audience. Thank you so much for having me. It seems like an evolution of exercise oncology in the last 20 years, hasn't it? A lot to talk about.
Thank you so much for having time for us and joining our podcast. It's an honor for us to have you today.
Thank you so much.
Before we begin, I would like to ask one question. Could you share with us how your interest in exercise oncology and cancer wellness emerged, and what inspired you to make such a remarkable difference in the lives of cancer survivors?
That's always my favorite question, is how did I get into this field? 20 years ago, actually, I was working in the fitness setting, working actually as a personal trainer. And so I say that to anybody kind of thinking about where, your career can start, where it can go. And I was connected with a woman who was 2 years post-treatment and surgeries from breast cancer. She was a triple negative breast cancer, so potentially a low survival rate. She was wanting to exercise because she wanted to feel better, but she had terrible lymphedema in her right arm, and still some of the worst lymphedema I've seen today: depression, anxiety, sleep problems, abdominal obesity, everything after cancer. Wow. And she said to me, "Do you think you can help me?" And at that very moment, I said, "Yes, absolutely." And I look back and I said, I don't know if I was naive or silly or, just didn't know, but I knew at that moment in that conversation, exercise would be valuable to her. And it just felt like the right place for me to be. And I've never looked back. So 20 years later, and she's still a great friend of mine today.
Wow, thank you so much for sharing your inspiring story. It's very wonderful to hear how this love emerged for the exercise oncology.
Definitely.
Now, let's begin with our interview.
Okay.
I'm really eager to dive into the topic of exercise and cancer. So what's the role of exercise in cancer, and how does it differ from physical activity and fitness?
Great question. I think it's really important for our conversation today and for anyone listening. We use these terms interchangeably, like if we say cancer. So we're speaking about cancer in a broad sense. We'll talk about specific topics, but exercise in my mind has three really different areas. Exercise itself, which is where a lot of the evidence lies, is looking at exercise as a purposeful type of movement. So aerobic exercise or strengthening exercise or balance exercise. Physical activity, which we've had a lot of research and we still see a lot of research in, just thinking about any type of movement the body does. Rolling over in bed, making a meal, taking a walk, just something leisurely is all physical activity. And then the aspect of fitness is that outcome. So cardiovascular fitness, strengthening, etc. Where we want to focus our framework today is on what is the role of exercise, that planned, purposeful movement and those types of movement? And what have we seen in evidence and recommendations? Because I do think when you read the literature and talk to people, we use terms interchangeably. My last addition to this is I don't think we should be afraid to talk about exercise in cancer because there is no sugarcoat in cancer. And so we want to educate people with good information, not just it's okay to be active. No, it's important to exercise and to have planned movement. So that is the relevance of a lot of the evidence we'll talk about today.
Thank you so much for sharing a deep insight on the role of the exercise in cancer. Now, let's talk about the current exercise recommendations for individuals with cancer. What are they?
Great question. They actually are the same as the recommendations for any adult living in the world that should meet the same guidelines. And these are 150 minutes of moderate intensity exercise per week or 75 minutes of vigorous intensity of exercise per week. That includes 2 days of full body resistance training, some balance, as well as some recovery or mobility types of movements. I do think it is important to say that you don't have to necessarily do it all at one time. Research has shown you can do it, 3 times a day for 10 minutes, or even on the weekend as kind of a weekend warrior, and you still get benefit. But the goal is, it is recommended for anyone impacted by cancer after the day of diagnosis to meet these guidelines each week. I do want to add that these guidelines have constantly evolved and been updated in my career. So our first guidelines for exercise didn't publish until right around like 2008, 2009. And those were just very general. And the most recent guidelines, the recommendations I'm discussing today, are the ones that added resistance training, were not published until 2018. So just the last 5 years, we've seen that people with cancer should strive to meet these guidelines, no matter what type of cancer or what age or any of their functional levels. So really important to think about that broadly.
It's fantastic to have these specific guidelines to work with. Now, let's move on to the next question. Can you explain the role of exercise in cancer treatment and how it benefits the patients?
Definitely. I think what we really know is that any kind of exercise, even a little, is going to have general benefits for our cancer patients, that we can mitigate or reduce many of the most common side effects that patients experience, predominantly things like fatigue, loss of strength, loss of energy, poor sleep, etc. So I think that it's really important to note that we see some of these general benefits on a kind of daily basis in the short term. Someone starts exercising and they just feel that burst of energy. In the longer term perspective is when we start to see things like cardiovascular health, or reducing the side effects of things like cardiotoxicity, which could be heart damage from chemotherapies. And I think it's really important to note that we don't have a cause, and we don't always have an exact, like, if you have fatigue, you should exercise this exact kind. But what we do know is that any exercise, and especially trying to meet the recommendations, is beneficial. I do think it's of note, timing here in 2023 when we're recording this, we are also seeing really interesting benefits in things like gut microbiome. And knowing that exercise actually improves gut microbiome, which has a lot of other general benefits and broad benefits for cancer survivors in the general population, the immune system. So being susceptible from infections, but also things like the flu or even COVID has a lot of benefits in exercise. So I think that the benefits are broad. And the last thing I would add here is that we should note that most people that participate in exercise have other healthy lifestyle habits. So they're not just exercising, they tend to have a little bit better nutrition, eating strategy, they sleep a little bit better. So there's a lot of synergies here. And I think that is important to mention for all of my lifestyle medicine colleagues. It's not one thing, but the evidence in exercise is quite strong as a benefit.
Wow, exercise seems to be a real game changer for cancer patients during their treatment journey. But,
Dr. Nigar, that is what I want to get across. Thank you for saying that. I love that.
Of course, lifestyle modifications is very necessary, not only when it comes to cancer, but when it comes to any form of disease. Lifestyle is one of the most important factors.
Absolutely.
Which patients miss on.
Definitely, for sure.
But how does it change for individuals after their treatment is completed?
And I think that's a great question. When you're undergoing treatment, and let's think really broadly here. Let's think about, chemotherapy, radiation, general immunotherapies where you're taking these medications for months to years. We know that sometimes our goal of exercise and other lifestyle habits isn't necessarily to, feel 20 times better. It's to reduce the amount of negative side effects that can happen from the treatments, right? During. After treatment is when I tell people it is time to focus on rebuilding, regaining, or if you've never done these kinds of interventions, starting. So that's typically when we will see people make a lot more progression in their function, progression in their nutrition or sleep is after. And I think it is important to note that sometimes, especially after long bouts of chemotherapy or multimodal treatments, that patients do decline. They decline functionally. They notice it in the mirror. They notice how they feel. So they are starting from a deficit. First goal after treatment is to recover to your baseline and then to move above and beyond to reduce your risk of other diseases and in some cases cancer recurrence. So I think the time points of having that framework is key for people because during cancer they want to do everything. And I said, this is maybe not the time where you should think about achieving, your next best fitness goal. Now, if you're going to be in treatment for the rest of your life, such as with an advanced cancer, and you want to do something as an event, you can get there, but may look differently. Your path may be slower. But if you're done with treatment, it is time to go. Get going, taking care of yourself is really key, and that's the best time.
Thank you so much, Sami, for your insightful answer. Now, let's talk about some specific exercise intervention studies or programs that have shown remarkable outcomes in cancer patients. What should oncologists or patients know about these?
Well, I think we should really know that there are really strong studies showing the benefits of exercise. Again, like really thinking about any side effect that a patient might experience, we're going to see benefit. I do think that we are seeing really strong research highlighting the role of exercise in very specific types or stages of cancer. Like if we look at something as broad as colorectal cancer, we have prevention to surviving metastatic disease, really strong evidence of the role of exercise. The amount of exercise may be different, the modality may be different, but exercise is fundamental. I think it's really important to know that. But I also think it's important to say that if you have maybe a more rare type of cancer, a less commonly studied type of cancer, thinking about maybe a pancreatic cancer or some of the types of blood cancer, there may not be a study. And that doesn't mean that you shouldn't exercise. It just means maybe we don't have as much very specific evidence. So I always tell oncologists and patients, we go back to the basic guidelines that anyone with cancer who's alive today, no matter if they're 2 years, 5 years, living with advanced, should exercise. And we know that there are definitely a lot of benefits. I think where we struggle sometimes is that we want to be very prescriptive. And exercise isn't always as prescriptive. It's also very personal. So I feel like sometimes it's okay to know that there's really solid evidence and then to talk about what is it you enjoy and what do you have access to. If you don't like the pool, then I don't want you to go swimming. If you don't want to walk, you don't live in a safe place, maybe it's too hot, then exercise indoors or at home. So I think it's important to kind of know the evidence is there, but there's a lot of individuality. And I think that's one of the great tools about exercise is it has very broad application for anybody and everybody, no matter what we like or dislike as well.
Now let's explore how exercise impacts common side effects experienced by cancer patients like fatigue, neuropathy, or pain, and so on.
Yep. Great question. And I know we've kind of touched about this throughout, but I think one of the things that we have noticed is that there are very specific things that we know related to side effects. So for fatigue, the number one most reported side effect, having a combination of aerobic and resistance training is really key because we want to make sure we're building up muscle, but we're keeping our body active from an endurance standpoint. If you have neuropathy, that loss of feeling in your fingers and your toes, having an emphasis on balance training, as well as strength training is key. If you're managing or, challenged with chemo brain or cognition, aerobic exercise is become to be the most effective because it has that improvement in your vascular system and driving blood flow to the brain. Pain management. It depends on the location of your pain. We want to strengthen the muscles that might support that area of pain. So I think it's really important when we think about side effects to be a little more individual, but just know that, again, if you don't know how to manage a side effect, just start moving. And that itself could be good. It is also important to note that almost every part of our world has professionals trained in exercise oncology. That might be rehab professionals or physiotherapists, depending on the part of the world you live in. And if you don't know where to start, finding someone for supervision and guidance is really helpful, even if it's in person or if you can't do in person, even online. So I think it's really important if you are confused, just to make sure you get some guidance there and some support.
It's incredible how exercise tackles such common challenges faced by cancer patients. However, I'm wondering if there are potential risks or considerations when implementing an exercise program for cancer patients. What should we be aware of?
Really important question, because we can all get excited about it. It sounds great for everybody, and as it is, there are some times that we should be concerned. So really the only thing that other than if someone is having significant pain or they're not able to eat anything, have a really severe infection, thinking very sick or hospitalized patients, almost every patient can still exercise. Where we want to be really aware is someone is having tachycardia, which is high heart rate at rest. So if they're feeling their pulse race, especially if they're on chemotherapy, we don't want them to be active. It's risky, and there's typically something else going on that needs to be addressed by their oncologist. Other than that, we don't have any really specific things. One thing that comes up for consideration is advanced cancer, primary cancer that's gone maybe to like the bones or the brain. If someone is having a side effect that makes them unsafe for independent exercise, what we want to do is make sure that they have access to supervised exercise for safety. If they can't exercise independently, then we need to either give them chair-based exercises, bed-based exercises, or have them do supervised exercise. So I think safety should be a consideration, but if someone doesn't have a side effect, they're walking okay, even if it's slow, and they want to take a walk, they should. If they want to do a certain type of exercise, they should. But those are really the main ones that we want to recommend that they wait on exercise until they're feeling better or have supervised exercise. But anyone else, they should start. They can even start now. Sitting here listening to this, do a few arm presses, stand up out of your chair. Anything like that could be really beneficial right here in this moment.
Perfect. Now let's tackle the next question. Are there any specific types of exercise that should be avoided for individuals with cancer?
Kind of not really. It's typically individual. I would say it's much more on the person, not the cancer. Now, if there's a location of cancer, like we mentioned briefly on like a bone disease, someone has got bone cancer, like multiple myeloma or a metastasis in a weight-loading bone, maybe they should avoid certain movements. But typically what I tell people is you want to exercise where you feel good, kind of muscle pain, muscle fatigue, but nothing that's sharp shooting, searing, anything that doesn't resolve with a little bit of rest. Other than that, it's very much based on the individual's function and much less on the cancer, ironically, in the conversation today talking about cancer. But yes, good point.
So it's important to consider the limitations when designing an exercise program. We should look at all the factors that may affect the patient.
Definitely.
Moving on to the next question. Can you discuss when it is important for an individual to have personalized and supervised exercise prescriptions for cancer patients versus when it is safe for them to exercise independently?
Great question. Really important. There's a lot of very specific things we might address. The number one thing that I ask people to do, and I would encourage our audience to try it, whether you're a physician or caregiver or patient, sit in a hard back chair. stand up, sit back down, stand back up, right? Do this 5 times. If you can complete this with maybe a little bit of assistance, or very little difficulty, you're typically considered to be safe exercising on your own. If you find that you really cannot complete this, you're having to use, the chair to push you up, you're having a hard time with your balance, you're getting dizzy, then you should have supervised exercise. It's a great way to kind of look at function. Another really great self-test is stand up, walk across the room, turn, walk back to where your chair is, and sit back down. Same thing. If you can do it with very little difficulty, you're typically considered to be safe to exercise independently. If you are like, whoa, I'm dizzy, I can't walk very fast, I recommend supervised exercise. Now, again, fairly general, but it's a nice line for people to know, do I need supervised exercise? Now, if you have a difficult time getting out of a chair, and yes, I might say, I would love you to have supervised exercise, but that might be difficult for you with time, logistics, finances, then I want you to have very supported exercise. Chair exercise is great. There's lots of things you can do from a chair that are not easier, they're just at the right level. But really think about your function and safety, and that's your line in the sand. The other thing is, if you're like, I really want a personalized plan, find someone to give you a personalized plan. It is worth the investment to have someone help you. So, but it's that at that point, it is kind of a choice. And for some people, it may makes more sense to do independent, and because they don't need it. But you can find it very beneficial to have that recommendation from a professional like myself and colleagues that I work with.
That makes sense. Like personalized guidance is vital, I think, especially for patients dealing with intricate health situations.
Agreed. Good point. Yep.
Now let's dive into recent guideline updates you were involved in. In the 2022 American Society of Clinical Oncology updates for individuals going through treatment and the bone metastasis recommendations.
Such exciting updates. It's crazy. This has only been a year ago. So in 2022, I was part of a group of authors from the American Society of Clinical Oncology, or one of the biggest oncologist organizations in the world. And we reviewed all of the literature looking at exercise. It was actually part of nutrition and weight management for patients in treatment of curative intent. So, and what the guideline stated was, it is recommended that every patient undergoing treatment of curative intent strive to meet exercise guidelines at an appropriate fitness level. And I think that's really important to say, that we are now reiterating this during treatment phase that we've never seen in literature before. We've always said, oh, anybody, but everybody would wonder, as we talked about earlier, Dr. Nigar, like, what about during? And so we just really did a good literature review, which was worldwide literature, of how important it was and how safe it was. Then thinking about that advanced cancer population, the same year, it actually was just a little bit earlier. So the ASCO guidelines include these guidelines as reference that we published, again, not recommendations, but guidelines and parameters for health professionals, how to support individuals living with advanced cancer to the bone. So that concludes bone metastasis from a primary location and multiple myeloma. And what this recommendation is slightly different, saying that the benefits of exercise outweigh the risks, but we are recommending that supervised exercise be the place to start. So these new recommendations and guidelines, again, a little different but similar, were both just published really in the last 18 months, supporting the benefit of this, but thinking about kind of that line we mentioned earlier, bone metastasis, functional changes, supervised is the best place to start. But anybody with these types of stages of treatment or disease should be encouraged and given that green light. Yes, talk to your oncologist about this. It's time for you to do it.
Thank you so much for sharing those guidelines, Sami. It's great to see how exercise is becoming an integral part of cancer care. Now, let's move on to the next question. Recent research highlights the impact of exercise on mental health. How can exercise help manage the psychological and emotional aspects of cancer treatment, such as anxiety and depression?
Such an important point, especially with the mental health across the world. For about the last 10 years, we've been studying general mental health benefits under quality of life for all types of cancer survivors. different disease types, stages, etc. And we've really have seen benefits in general quality of life and well-being. But over the last few years, we've started to look a little bit deeper into understanding, how does exercise help with anxiety? How does exercise help with sleep? And while we have seen strong benefits and we've definitely seen positive outcomes, we've started to realize that the type of exercise may be a little bit more important in this particular scenario. So if someone's having a lot of anxiety, having a type of exercise that's maybe a more low intensity, like a yoga or Tai Chi, or something that's a little bit more about breath work, is more beneficial. If someone's having a lot of depression, we want to incorporate things that might be more aerobic or more resistance. But again, going back to my basics, something is better than nothing. But I think it's important that we think about, when someone's in front of us having mental health challenges, what are they experiencing? And how is this impacting their day-to-day life? And then trying to make guidance and recommendations based upon that, recognizing if you're having a lot of depression, a recommendation of exercise is something that might be very hard for that individual. So we want to think about, how do we incorporate what's the right time of day, or, having those conversations with the patient. What are they willing to do? What do they have access to? Because if someone is not self-motivated, they may not partake, even though they know it's beneficial. But no, we have the evidence, and we need to have these conversations for the mental health of our cancer survivors.
It's truly amazing how exercise can positively impact the mental health and emotional well-being. Now, let's discuss the impact of exercise on long-term outcomes, such as recurrence rates or overall survival in cancer patients.
Really vital, because that's what cancer survivors want, right? Is I want to live my longest life. If this disease is going to kill me, how do I improve my odds of survival? We do know we have strong survival evidence in really 3 types currently here in 2023 that have been published in 3 types of cancer. That is breast, prostate, colorectal. So we know specifically that with randomized control trials that these patients have better survival rates. With that said, just because we don't have this evidence in other types of cancer doesn't mean it's irrelevant. We have general improvements in mortality through more strong, what we call observational studies. So rather than, put someone in lane A or lane B, we look at them retrospectively in observational studies. So we know that in observational studies for adults, not only cancer, but all causes have improved outcomes and improved survival with meeting the recommendations of aerobic and resistance training. And I think that's important to say. We used to think, just any type of exercise. It's actually about 15% higher for all causes to improve mortality by adding resistance training. And I think that's more relevant here in 2023, because we don't live these physically active lives like maybe our parents did, where they, mowed their own yard and they did a lot of their own physical things. So I think that we now need this resistance training to improve our survival, but we do have this data. So even if it isn't in a, brain cancer, we do know from observational studies that it still can improve your overall survival from everything, not just cancer.
That's incredible. Exercise truly seems to be a game changer in the fight against cancer. Now, with the increased usage of immunotherapy in cancer treatment, how does exercise complement and support immunotherapy treatments?
So important to talk about, because immunotherapy really is the wave of the future of treatments. So we did know when immunotherapy first started that a lot of times we felt that our patients actually just felt better during treatment, and they could be more active. They could they could actually exercise. So there was just a little bit more ability. Now what we're starting to really look at is, we have research studies that show that exercise stimulates the immune system, which is actually the job of immunotherapy, to stimulate the immune system to fight the cancer. So exercise as a supportive modality, not an alternative, but a supportive modality, actually can improve how the immune system fights in cancer. So again, still early stage there, really looking at these kinds of studies, but kind of thinking about, all right, how can we enhance what we know is important treatments? Same thing we talked about with chemotherapy or radiation therapy. We know that there are going to be side effects, but can exercise reduce those side effects? And I think that's one of the things that we've learned. But in immunotherapy, it's unique because it can actually help and make that medication even more enhanced by making the immune system stronger. So I think that's really the key thing that we're starting to see in immunotherapy here in this 2023 timeframe. Anyway, a lot of new studies happening. I would say the next few years will produce much more randomized control trials.
Thank you so much for the valuable insight, Sami. Now, combining exercise with immunotherapy seems like a promising approach. Now, let's talk about any research or evidence supporting the combination of exercise and immunotherapy in improving treatment outcomes for cancer patients.
Again, same thing, kind of, still early stage, but I would say what we are seeing is that we know that most of these patients maybe are compromised already coming in the door with like their immune system, with how they're feeling overall. And I think exercise can enhance that. I do expect that we will see, because the number one way that we treat the side effects of immunotherapy is steroids. So steroids, although they reduce that inflammation response that comes from immunotherapy, also promote loss of muscle because they're considered to be catabolic steroids, not anabolic steroids like used in a gym setting. So one of the things that we know is that if we're having to treat these patients with steroids, exercise actually is a nice counteraction for those patients that have to take those anabolic medications. I haven't seen significant evidence yet in true randomized control trials with exercise as an adjunct type of therapy. But like I said, I expect that's where things are going to be going, which is why I'm so glad we're talking about it here, because I want us to think about that when we're treating patients as oncologists or patients undergoing treatment, that this is a complementary and vital, especially during immunotherapy opportunity. People ask about what they should eat, with cancer all the time, like, how do I improve my cancer survival with a diet? And my response is like, well, you really can't. I mean, you can reduce side effects sometimes, and you can reduce, how you feel. But I think this is very different in exercise, and actually why I think it's so important to talk about today.
Now, as we near the end of our discussion, what do you believe is the most important takeaway for patients and providers regarding exercise?
Well, Dr. Nigar, you said it, that it's a game changer. If I could say that a number of times, I would. I tell people it's kind of like pixie dust. And that seems a little silly to say, but there's something so powerful physically and mentally about exercise. It empowers patients and caregivers to feel like they're doing something. I think it's really underutilized. And I wonder if it's because we think there needs to be a perfect exercise, prescription or a perfect place or whatever. And I think that what I want people to realize is, let's say you get out of your chair 5 times in the morning and you do 5 in the afternoon and 5 in the evening. That's a great start. You don't have to, hit the gym 3, 4, 5 days a week to see benefit. And I think that's one of the things that I really think is underutilized, but should be utilized more. So it is very, as you said, it is a game changer for all of us. And for you and I, it's a game changer in prevention and for chronic disease. And I think it could be it's an easy access tool as well. So I love being able to be here talking about it. So I really appreciate the opportunity.
Sami, thank you so much for sharing your expertise and engaging in this enlightening conversation. Exercise role in cancer care is truly inspiring, and your knowledge in this field is truly commendable. I'm sure the patients and providers alike will benefit greatly from the valuable insights you have provided us today with. Keep up the fantastic work.
Thank you so much.
And before we conclude, we would like to take a moment to acknowledge MedSynapse. MedSynapse is a leading platform that brings together healthcare professionals, fostering collaboration and knowledge sharing. We encourage you to subscribe to MedSynapse to stay updated with engaging discussions and gain access to a wealth of knowledge from experts in our medical community. Don't miss out on the opportunity to expand your understanding and stay informed about the latest developments. That's it for today's podcast. Thank you for joining us, and stay tuned for our next episode. Take care and stay curious.